Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Shri. Let's look at today's daily bulletin. The Centre on Monday approved lowering the cut-off marks for admission to PG medical courses for 2022 and 23, while taking into consideration that a large number of seats had gone vacant in the PG counselling held for the last academic session. The reduction in cut-off marks will be by 25 percentile across all categories. Amid the major initiative of introducing medical education in Hindi, the Chief Minister of Madhya Pradesh, Shivraj Singh Chauhan, suggested on Saturday that doctors may write Shri on the top of prescription slips and then write the list of medicines in Hindi. The Chief Minister made these remarks while addressing a program on the eve of Union Minister Amit Shah launching the Madhya Pradesh government's ambitious project to impart medical education in Hindi. Some pain, cramping and discomfort during menstrual periods is normal, but excessive pain that causes you to miss work or school is not. Painful menstruation is also called dysmenorrhea. Dysmenorrhea is the leading cause of school absences for adolescent girls, but very few girls seek treatment for the same. Researchers have conducted analysis of relevant studies and found that diet may be a key contributor, specifically diets high in meat, oil, sugar, salt and coffee, which have been shown to cause inflammation. Results of the research was presented at the North American Menopause Society annual meeting in Atlanta, which was from 12 to 15 of October 2022. Roughly 90% of adolescent girls experience menstrual pain. Most use over-the-counter medicine to manage the pain, but with limited positive results. Evidence has highlighted that diets high in omega-3 fatty acids and low in processed foods, oil and sugar reduce inflammation, a key contributor to menstrual pain.
Targeted therapies specifically attach to and hinder cancer-causing proteins, but cancer cells can quickly evolve to thwart the action. A second drug class, immunotherapies, harness the immune system to attack cancer cells, but these agents often cannot see the disease-causing changes happening inside cancer cells, which look normal from the outside. Now, a new study led by researchers from the Perlmutter Cancer Center at NYU Langone Health describes a strategy to overcome these limitations based on several insights. UVA health researchers have discovered a molecule in the brain responsible for orchestrating the immune system's response to Alzheimer's disease and multiple sclerosis or MS, potentially allowing doctors to supercharge the body's ability to fight those and other devastating neurological diseases. People with a disease characterized by lung scarring that has no obvious cause are more likely to die if they live in areas with higher levels of air pollution composed of chemicals associated with industrial sources and vehicular traffic, according to new research led by University of Pittsburgh scientists. Strict parenting can alter the way the body reads the DNA of the children. These changes can effectively become hardwired to the DNA of those children who perceive their parents as harsh, increasing their biological risk for depression in adolescence and later life.
Chronic kidney disease is a global burden and is often commonly characterized by traditional risk factors including diabetes, hypertension, glomerulonephritis, but it is emerging as a serious health problem, especially in the state of Odisha, India. Now, this is as per a new cross-sectional study that was conducted on 124 consecutive patients with chronic kidney disease, a new form of severe chronic kidney disease affecting adults being named as a chronic kidney disease of unknown origin, and it is considered fatal due to the late recognition as well as its rapid disease progression. Now, a questionnaire was answered, and after the necessary history, clinical evaluation, as well as the blood and urine analysis, a kidney biopsy was undertaken. Kidney biopsy was only considered feasible in 51 patients, as the rest of the 61 patients had shrunken kidneys. Among these 51, 23 had chronic kidney disease of unknown origin, 25 had chronic glomerulonephritis, and 3 biopsies were inconclusive. The results show that a family history of chronic kidney disease was seen in 82.6% of chronic kidney disease of unknown origin cases. Hyponatremia as well as hypokalemia were predominant biochemical abnormalities. There was an increased risk of developing CKD of unknown origin in persons with a family history of chronic kidney disease persons exposed to smoke from burning coal, charcoal or biomass fuels, as well as patients with low socioeconomic status. Interstitial fibrosis, interstitial inflammation with mononuclear infiltration, tubular atrophy, as well as global glomerulosclerosis were pertinent histopathological findings in this study. The researchers hence concluded that there is no strong evidence for a single cause for CKD of unknown origin, and multiple environmental, occupational as well as social factors are probably involved, and so the identification of such etiologies of chronic kidney disease of unknown origin across high-risk populations may help elucidate the importance of risk factors. Hematohidrosis is a rare pathophysiological condition of sweating blood. Yes, you heard it right. History also has quoted this rare disease where it is said Jesus sweated blood before his crucifixion, and the great artist Leonardo da Vinci wrote about a soldier who had bloody sweat after a battle. However, with rare pathophysiology, this disease has been recorded very rarely. So I'm going to talk about a case study of a young lady who presented with abrupt bleeding from the skin. The bleeding was vanished after wiping with no sight of injury, but it even reappeared soon enough, confirming its nature. Bleeding time, the clotting time as well as the prothrombin time was well within the normal limits. This 19-year-old female presented with a tendency of complaints of occasional loss of consciousness at home with violent random movements of limbs and bending of the spine, followed by spontaneous recovery along with bleeding from the nose and the eyes. She was hospitalized 4 years ago as she was found unconscious at her home stairway with bleeding from her nose and the ears. CBC, the coagulation profile, the CT brain was all normal as she was discharged after observation. A similar episode of bleeding from the nose and the mouth occurred after a month, and again she was hospitalized, but once again the blood profile parameters were all normal. Confusing, right? So ENT consultation revealed no source of bleeding even after fiber optic laryngoscopy, and she was advised to take oral tranexamic acid at home in case of an emergency. So a couple of similar episodes happened as she was taking psychiatric therapy for anxiety disorder, as loss of consciousness was considered anxiety sequelae. In 2018, she also developed new symptoms, that is shedding of bloody tears associated with bloody salivation. Benzidine test was found positive for tear and saliva samples, proving the theory of the presence of blood mixed with saliva and tears. So as of now, the researchers highlighted that psychological anxiety is a predisposing cause for hematohidrosis. So in conclusion, though it is a very rarely reported case history in medical literature, doctors should keep a close watch on their daily patient interactions to register more cases of hematohidrosis to know further about the condition. Barrett's esophagus is a common condition in which the flat pink lining of the esophagus, it becomes damaged by repeated acid reflux, which causes the lining to thicken and become red. So Barrett's esophagus is a complication of the gastroesophageal reflux disease, and it is commonly seen in among 15% of gastroesophageal reflux disease patients. Barrett's has malignant potential, and annual progression to carcinoma depends on the presence or even the absence of dysplasia. So the researchers in this cross-sectional study compared two symptomatic cohorts of GERD patients from the same geographical area who were eventually evaluated for the presence of Barrett's esophagus and various factors that can contribute to this. So two GERD cohorts, one from Kottayam district and the other from Trivandrum, were taken. The presence of Barrett's and the factors contributing to the development of Barrett's were analyzed between the two groups. A total of 415 patients were enrolled for the study, 192 males and 223 females, and it was found that Barrett's esophagus and especially the long segment Barrett's were significantly more common in Kottayam than in Trivandrum. Also, the duration of GERD symptoms was significantly more in the Trivandrum cohort than the Kottayam cohort. Hiatus hernia as well as the BMI were more common in Kottayam. Hence, it was concluded that though both Trivandrum and Kottayam belong to the same geographical area and are separated only by a distance of about 150 kilometers, the Kottayam cohort is more prone to develop distal esophageal carcinoma, as the Barrett's esophagus is more common in Kottayam. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.